Okay, so we'll go ahead and get started. Again, welcome. We are going to be talking about workstation ergonomics and stretching today from either the home or the office. Again, my name is Dr. Marcus Steward. I am the physical medicine doctor or chiropractor here at Align Modern Health in South Loop. Just a quick introduction about what we do here at Align Modern Health. We do specialize in integrative medicine, and our treatment plans include everything from chiropractic to acupuncture to massage therapy to functional medicine and clinical nutrition. You know, we aim at getting to the root cause, as looking at the person as a whole and not just a symptom or condition. As the chiropractic doctor here, or physical medicine doctor here, I deal with musculoskeletal pain, injury prevention, rehab. So we deal with patients who have sciatica, arthritis pain, even patients that have pregnancy pain. We also deal with vertebral disc disorders, as well as helping our athletes improve and stay at peak performance. Our acupuncturists are great at dealing with stress and anxiety, muscle tension, men and women's health, fatigue, sleeplessness, as well as they do cupping, and they also work with fertility as well too. Our clinical massage therapists deal with muscle soreness, tightness, headaches, soft tissue strains, and injuries. They also help patients with anxiety and stress. They are wonderful with post and pre-pregnancy pain, as well as fibromyalgia. And then our functional medicine team and clinical nutrition team do a very great job at helping patients with gastrointestinal issues, autoimmune disorders, bloating, constipation, fatigue, as well as food sensitivities. And they also deal with weight management and nutrition counseling. So just a little bit more about me and who I am. Again, my name is Dr. Marcus Steward. I'm the chiropractic physician here at Align Modern Health in South Loop. I graduated with my Doctor of Chiropractic degree from Parker University in Dallas, Texas, as well as a Master's in Science and Practice Management from Parker University. I also graduated with a Bachelor's of Science in Biology from the University of Texas. And my passions do include helping patients with musculoskeletal pain, sport injuries, chronic pain, and as well as overall family wellness. So like I said today, we're going to talk about ergonomics. And I know many of us have our own idea or definition of ergonomics, but you may have been wondering, what exactly is ergonomics? We hear this word all the time. Well, in the Merriam-Webster dictionary, they define ergonomics as an applied science concerned with designing and arranging things people use every day so that people are using these things and are acting with them in the most efficient way and safely. So that's what we're going to talk about, how we can do that in our home as well as in our office. So why even care about ergonomics, right? We hear this word all the time, but why does it matter? Well, it matters because we are, I would say, creatures of habit. So we do the same routine day in and day out, and we call that repetitive movements. And over time, with those repetitive movements, that can cause stress on your muscles and your joints, as well as that can lead up to you having pain. So I always tell patients, pain is always the last thing to show up, but you may notice you were tight or stiff over time, but it just kept coming or going. Well, only after that tissue has been overstressed is normally when the pain shows up. So we want to help patients with preventative efforts that can limit this bodily stress and mitigate the effects of desk work. I always call it like if you ever have cut your finger and you got a scab over your finger. It might have hurt when you first cut it, but the pain went away, but the scab is still there. So imagine you kept picking away at that scab. What would happen over time? That tissue will never heal and it will hurt more. So that's kind of how what repetitive motions can do to our muscles and joints. So as you take a look at this picture, I know if you are a mathematician like me, you will probably add these numbers up and realize they do not add up to 100%. And there's a reason why. So these are the most common areas that patients complain about when they get pain from sitting at their desk hunched over every day. And at any time, any of these areas can hurt more than the others. Sometimes they all hurt equally as each other. So that you might feel like the lower back and neck both hurt 100% of the time, or even along with the shoulders and the wrists. Most commonly, we get lower back pain patients from sitting for so long, and that's why we put 63% there, and then the neck pain, and then shoulder and wrist. So these are the most common areas. Sometimes they can all hurt together 100% all the time, or just maybe one area may hurt 100%. Now, when you're setting up your workstation, I want you to keep a few things in mind. As you can see over here to the right, when we talk about the major joints, like your elbows, your hips, and your knees and ankles, I want you to think of 90-degree angles. So I call it the 90-90-90. Elbows, hips, knees, ankles, all at 90 degrees. So as we look into our diagram over here, you might notice how the computer monitor is aligned with the eyes so that it's straight in front of you. So we're not having to either look down too far for too long or look all the way up to the ceiling for too long. As well as our keyboard being parallel to our wrist. This is a great idea for patients that have carpal tunnel or wrist pain. You don't want to have your wrist bent downward or upward for too long because that can cause more tension around the wrist, aggravating those wrist joints and causing pain there. So have your keyboard close to you and have it parallel with your arms, and then have those elbows at 90 degrees. And then as you notice the chair as well too, with the hips and the knees being at 90 degrees. Now, if you can't get your feet flat on the floor, you can always use a small like footstool like we have in the picture here to help support your feet and stabilize with the footrest. So when we talk about our monitor being at a safe distance for our necks, so your screen should be at least about 22 to 26 inches away to reduce the eye strain, and as well as having your monitor about 17 to 19 degrees above where you're looking. So, and having it right in front of you. And then for patients that have multiple monitors, I always tell them, make sure you have your primary monitor that you use the most right directly in front of you. And then it's okay to have your secondary monitor off to the side. That way you're not constantly having to turn your neck or look to this way all day, whether you're sitting for 4 hours or 8 hours. Our laptop users, here's a pro tip for you guys. When you are using a laptop as your primary computer or monitor, it's best that we use a riser. That will help bring that laptop up to eye level, and even add in a wireless keyboard or wireless mouse to also reduce neck strain as well. For our keyboards and mouse placement, I know this is oftentimes patients don't normally think about this that have wrist to elbow pain, but if you can imagine having your wrist in a bent position or having your elbows being extended for a long time, that could lead to joint discomfort. So I always say like the keyless keyboards or keyless mouse are the best way to place and use, but make sure you have that keyboard directly in front of you, parallel to your desk, and bring it closer to the edge. So if you look to that picture that's over off to the left there with the X, that would be too far. That would cause strain on your neck. But the one with the check mark, the green check mark, it's closer to you, closer to the edge, and you have better range of motion with the wireless mouse and keyboard. So when we think of our head and necks, we often don't think of how much it weighs. So on average, our head can weigh anywhere from 8 to 12 pounds, kind of like a bowling ball that you may use, right? So if you have that bowling ball right here in your hand and it's here, this is good support. But imagine taking that 8 to 12 bowling ball and tilting it forward and down, right? Imagine how heavy that's going to feel on your neck and your shoulders. So that bowling ball goes from weighing 8 to 12 pounds to almost 40 to 50 pounds. So keeping your head over your shoulders in that neutral position will decrease a lot of the workload that your muscles back here to help hold you up, which call those the computer muscles, from overworking. When you overwork those muscles, this is what can lead to injury. So making sure you're having good posture, head over your shoulders or ear over your shoulders, will help mitigate that wrist injury for you. So for your lower back support, when you're sitting in a chair, this is very important. So we talked about having our hips and our knees and our ankles 90 degrees, but let's also talk about our lower back. So there's a curvature in your lower back spine that you want to maintain for proper posture to take the stress off of your joints. And we use these lumbar supports in our office as well as we sell them. And we also sell them online at alignmodernhealth.com. But these lumbar supports can go right behind your back, just above your belt line. And you can adjust it and move it up and down to where you feel comfortable. They also have a strap on it so it doesn't, when you do get to where you need it to be, it doesn't keep moving on you. So when you lean back onto it, just enough so that your ears are aligned with your shoulder. And again, if it is uncomfortable, you can move it from the bottom forward slightly. It does take some time to get used to. So maybe the first day you might not want to use it for a full 8 hours, but break it in, maybe like an hour or two the first time, and then another hour increase each day until your body gets used to using that. And again, we do sell these in our clinics and as well as online at alignmodernhealth.com. All right, so my patients who have standing desks, there is a way to stand as well too. So I know I get a lot of questions as well. Should I sit? Should I stand? And I always say a combination of both is ideal, but if you prefer to stand, you want to make sure that you have proper standing desk ergonomics as well. So like, for example, I use a mat when I do stand up beneath my feet to help take off some of the stress on my ankles and feet, as well as on my hips. Also making sure your arms are at 90-degree angle. Your wrist, again, you want to have that wrist in the neutral position. So remember to bring that keyboard closer to you, to the edge. Make sure your computer is still eye level. And again, don't be too close to the screen, and as well as making sure you got that 17 to 18 inches above where you're looking. If you need to, you can also slightly bend your knees and shifting your weight occasionally. So try not to lean to one side for too long. I would say alternating from side to side, maybe even setting a timer for every 30 to 60 minutes to remind you to move or even get up and stretch. And then for my patients that wear heels, if you're standing for most of your day, take off the heels. So the heels are not going to be very comfortable for staying in it for 8 hours, but maybe bring like another pair of shoes that are more comfortable for you to stand in, and then putting the heels back on later. But again, remember to take a load off throughout your day. Like, try not to stand up for too long, try not to sit down for too long, maybe alternate every 60 minutes. You might be going to a water fountain. That's a great way to remind yourself to move around and stretch as well too, or try perching on a stool. Okay, so here is the fun part activity for today. We are going to do some workday stretches. So I'm going to go through some stretches with you that you can do at home or in your office. And I encourage everyone at home to do them with me. But I'm going to walk you through it. And then also with any of these stretches, if you get any pain, that's not normal. We don't want that. So stop the exercise, stop the stretch, find your local provider, either here at Align Martin Health, and get an exam to see why you're having that pain with that stretch. So the first one we're going to do is called diaphragmatic breathing. This is essentially a great core exercise that could lead to increased stability in your lower back spine. It's all about filling the belly up with air and then exhaling out. So keeping your chest and your shoulders still though. And don't worry, in the beginning, this is gonna feel weird, it's gonna be difficult. It does take a lot of practice. So I say practice, practice, practice at home or in your office. And you can also do this by lying on your back as well. So I'll demonstrate and I'll show you from this while I stand up so you can see the belly filling up as I do it. So again, please get up, do this with me. I encourage you all to do it. We are going to inhale through our nose and exhale through our mouth, and make sure we fill the belly up on that inhale. And we're going to do this 10 times. So we are going to put one hand on our belly and then one hand on our chest. We're going to inhale through our nose, fill the belly up, and exhale through the mouth. Okay, so I hope that was as good for you as it was for me. Again, make sure you're not getting any pain with that. If you do, please get that checked out with your local field of medical medicine or chiropractor here at Align Mountain Health to see why you're having that pain. Now, our next one is going to be what we call neck retractions. This is a great stretch for those muscles that we talked about earlier that help hold your shoulders down and your head over your shoulders. So these are the ones that get really stressed when you sit at a computer all day. So for this one, you want to make sure you sit, or you can stand up as well. Sit up straight, shoulders down, keep your chest and shoulders still. You're going to bring your head straight back over your neck and then return to neutral. We are also going to do this 10 times as well. So I'm going to show you from a side view here. And again, I encourage you all to follow along with me. All right, so we're going to look straight ahead. Shoulders and chest are going to stay still, and we're going to push our head back. Like that. Yeah, so kind of giving yourself a double chin. And we're going to do that 10 times in a row. Yeah, so you will feel, again, it's going to feel weird in the beginning. It's probably going to be very difficult. So the neck muscles are very, very tight, but it does take a lot of practice. So practice this one at home or in your office. And again, you do not, if you get pain in your neck or pain in your arms or shoulders, that's not normal. Stop the exercise and make sure you get checked out. For all these exercises that I'm teaching you today, when you do a set of 10, it's always great if you can do these 3 times a day with 3 sets of 10. But work your way up to that. Like I said, in the beginning, these are going to feel weird. They're going to be difficult. So break them in, maybe doing 1 set of 10, then 2 sets of 10. Each day, add another set of 10. Now, this one is called the slump overcorrect. So this one, we're going to slump, and then we're going to overcorrect it. This is a great way to reset your posture. When you're doing overcorrecting, we call it hyperextension, so arching your spine backwards, and then returning back to that neutral position. So we're going to repeat this one 10 times as well. And I'm going to show you from the side view. All right. So we're going to slouch over there, just like that. And then we're going to hyperextend, arching our back backwards. And then like a 1 to 2 second hold is good. We're going to do that 10 times. Good. All right. So that one should feel like a great reset, especially if you've been sitting for, 2 or 3 hours. Always great just to kind of reset those muscles, get everything loosened up, and then going back to work. You'll find that we are much more productive if our joints are not so tight or in pain. And again, make sure you're not getting any pain with those exercises. If you do, you want to stop them immediately. All right. So for our lower back patients, we teach them lower back extensions. You can do it lying down, but you can also do it standing. So after sitting all day, our backs are in what we call like a C shape, and this can cause a lot of strain in our lower back joints and our hips. So when you stand up, you're essentially going to place your hands on your lower back just above your pant line. You're going to push your hips forward and allow your back to arch. So only tipping your head back if you're comfortable, and then you return back to neutral. So you're going to do this 10 times in a row. And like I said, doing these exercises throughout your day, maybe morning, afternoon, and the evening. So 3 sets of 10 a day is a great way to keep the lower back in shape from being in that C shape all day. So I'll stand up and I'll demonstrate this one for you. And yes, please, I encourage you to get up and try it with me. So we're going to put our hands right above our belt line here, and we're going to gently arch back, push our hips forward. Great, and then come back to neutral. And we're going to do that 10 times in a row. Great. So good. So yeah, so that's a really great stretch to get those lower back muscles to loosen up, relieve that tension from your back from being in that C shape all day. And please, 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 if you do get any pain in your back or pain going down your legs into your buttocks, we don't want that. You want to stop the exercise immediately and seek help from your local chiropractor here at Align Modern Health. But making sure you're doing these throughout the day. And yes, it will feel weird in the beginning, but practicing these at home or your office more often, your body will get used to doing that stretch. All right, so for our patients that come in with wrist pain, hand pain, or elbow and forearm pain, we show them some wrist exercises they can do at home or in the office. So how we talked about the keyboard stress, whether they're having the keyboard too far away or the mouse too far away, or just using the keyboard repetitively every day can lead to carpal tunnel, pain in the wrist, pain in your arms. So for the first set up there, we call this range of motion exercises. So we're gonna actively move our wrist through all the ranges of motion, and that's gonna give you a great stretch. For example, with A, so you can kind of take your fingers like this, but we call this bending forward or flexion. So you could do that 10 times in a row as well. And this is a great way. You're probably gonna feel a stretch on the back of your wrist. And then we can go backwards. So like this, have your palm, and then going backwards. This is backwards bending, or we can call it extension as well. And then we're gonna move from side to side. So this way towards the radius and then towards the owner, side to side movements. These are all great stretches just to get that range of motion back in your wrist, especially after a long day of typing and using the mouse. Now for the next stretch, we're gonna help stretch those muscles that do the back and forward bending. And you can also use a table for this if you want a deeper stretch. But for now, I'll demonstrate with my hand. So for the first one, we call it forward bending, and we're gonna push into that stretch just gently, light to medium pressure, hold 3 to 5 seconds, and then release. And you can also do that 10 times in a row as well. So this is the forward bending stretch, and then we're kind of like stretching that wrist even more by using our hand. Yes. And then you can also do the same thing by going backwards. So taking the hand here at the fingertips are like this, and then gently pushing backwards. All right. So yeah. So again, you could do these stretches in a set of 10, as well as doing them 3 sets 3 times a day. And then the other one is dealing with the forearm muscles here that help you move your arm like this over a palm up and palm down. Doing that stretch will help with these muscles here in your forearms. So when these muscles get tight, from again using the mouse and keyboard, doing this palm up and palm down stretch is a great way to relieve stress around your wrists, your forearms, and your elbow. All right. And then also remember, if you get pain with these stretches or exercises as well, remember to consult your doctor. You want to stop them if you get any pain. Okay. So no matter what you do every day, at least once every day, 30 to 60 minutes, be sure to either stand up, move around, do some of the stretches that we taught you today. And a pro tip here would be, it's a great time for a water break, right? So a great time to get up, stay hydrated. It's a great way to keep the muscles from being overstressed and just helping loosen the muscles up and hydrating them throughout the day. So now we're gonna open it up to questions you may have using that Q&A feature on your screen. Also, if you do have more of a personalized question, we do offer free 15-minute consultations with our doctors here at Align Modern Health. You can call the number here on the screen or go to alignmodernhealth.com to actually schedule that 15-minute consultation if you have more personalized questions. But for now, I will go to the Q&A and I'll answer questions. All right, so I see we have a question that says, should we be using a wrist pad for the keyboard and mouse? So I would say yes. If you are having trouble at your desk getting that keyboard to be parallel with your wrist or getting close to the edge, then a pad is a great way to help maintain that neutral position of your wrist and your elbows. So I would say yes. If need be, you can use a wrist pad for sure. Now using the wireless or the wireless keypad keyboards and mouse as another great way to get that full range of motion, so you can bring it closer to the edge. So you may not need a pad if you got it close to the edge, because then you can keep your wrist parallel without using the pad. But if you can't keep your wrist parallel, then the pad is a great way to help. All right. And then we have the next question here. Is there any exercise to specifically help with neck pain and pain near the shoulder blade area due to mouse usage? So yeah, so those neck retraction ones are a great way. So that's the one I showed you, we're pushing our head over our shoulders. Doing that one instead of 10, 3 times a day is a great way to relieve that stress from using the mouse and being on the computer all day. But of course, if you're doing that stretch and you're still getting pain or the pain is getting worse, then you definitely want to consult one of the doctors here at Live Modern Health to see why you're having that pain with that stretch. All right. So the next one I got is, I roll my head and my neck a lot during the day. Is that okay? So this is, this is a yes and no kind of answer here. So, I mean, of course, you're stretching, you're rolling your neck, that's okay. But if you're getting like a lot of tension, a lot of pain, a lot of popping noises with that roll, then there might be something else that's going on there, or those joints might not be as stable as they should be. So that is something that you want to get checked out sooner rather than later to see why you keep having that feeling of wanting to roll your neck. All right. So I got a question here. It says, how do you know if your knees are at the right height, or should you change the height throughout the day? So if you can't get your knees or your hips 90-90 to the floor, then you may need to get a footrest to rest your feet on. So if you could imagine, if you aren't able to adjust your table or to adjust your chair, and you feel like your knees are either too high up or too low down, then a footstool will help, or see if you can get an adjustable table or an adjustable chair, but you want to have your knees and your hips 90 degrees when you're sitting in the chair to the floor. Yes, and I know a lot of patients have, so I see some questions here about hip pain and as well as hip exercises. So the one that we showed you with the lower back extensions, where you're standing up, that is a good one for the hips with the hip flexors, but you can also do that laying down to give you a deeper stretch with the hip flexors, and that will actually help with the hip pain as well. But again, if you are experiencing a lot of hip pain or a normal amount of hip pain, it's probably best to get that checked out. Again, you can always do a free 15-minute consult with one of our doctors to see exactly what's going on, because there may be something else there that's causing your hip pain as well. All right. Okay, so that's all the time that we have today for questions. Again, if you do need any personalized questions answered, please feel free to contact the number here, as well as go on to Live Modern Health to schedule a free 15-minute consult with one of our doctors here. Thank you all so much for being here today. It's been a pleasure going through these ergonomic exercises with you and talking about how you can set up proper ergonomics for you at home in your office.